Hello students. Now you are going to learn about a new unit, Unit 7, which is related on the topic drugs acting on nervous system. Especially this unit is related to those drugs to treat the central nervous system. At first, before getting into the topic, we must have the knowledge about manifestation of CNS depression and CNS stimulation. And also, this getting into this topic, firstly, we have to know how this stimulation and depression takes place. Neurohumoral transmission refer to the transmission of impulse through synapse and neuroeffector junction by the release of humoral means chemical substance called as neurotransmitter. These chemical are generally two types. Number one is excitatory neurotransmitter, which is show effects on neuron by excitation. This means they increase the likelihood action of the neuron, which will fire an action potential simultaneously. And in case of inhibitory neurotransmitter, it have the effect inhibitory action on neuron. That means they decrease the likelihood action by the neuron, which will fire an action in case of excitation, which is inhibited. This action is followed by the manifestation of CNS depression and CNS stimulation also. So what are the what are the topics regarding CNS stimulation? This is related with excitement, euphoria, insomnia, tremors, twitching, convulsion, and coma next to death. And in case of CNS depression, it is started with the drowsiness, then it may be the sedation, hypnosis, disorientation, confusion, unconsciousness, and coma. Last is death. Now, CNS depression topic related with sedative and hypnotics, which is related with sleep. It is a condition of body and mind which typically recurs for several hours every night, in which the nervous system is inactive, the eyes closed, the postural muscle gets relaxed, and consciousness partially suspended. The phases of sleep are related with non-rapid eye movement sleep and rapid eye movement sleep. Now, what are the function or role of sedative and hypnotic drugs? Sedative drugs reduce the excitement, calms the patient without inducing sleep. It may be used in a psychotic patient, it may be used in different types of surgical patient. In therapeutic doses, they are anxiolytic also. Most sedatives in larger doses produce hypnosis. The next topic I am coming to this. The site of action is on the limbic system, which is regulate the thought and mental function. The hypnotics. This is a drug which produces drowsiness, facilitates the onset and maintenance of a state of sleep that resemble natural sleep. They are used for initiation and maintenance of sleep. A higher dose of hypnotics can produce a general anesthetic action. Next is the classes of sedative and hypnotics. There are several classes are related to this sedative and hypnotics, but a broad classification of benzodiazepines and barbiturates are related in this session. Benzodiazepines named as diazepam, oxazepam, lorazepam, and barbiturated is related with phenobarbital, methylbarbital, pentobarbital, secobarbital, etc. So, firstly, what is the benzodiazepine role in case of sedation and hypnotics? All benzodiazepine have a benzene ring fused to a 7-membrane diazepine ring. The site of action is midbrain, generally limbic system, ascending reticular activating system, brainstem and cerebellum, etc. What is the function of benzodiazepine? It facilitates the action of GABA, which potentiate inhibitory effect of GABA A. Firstly, benzodiazepine bind to specific site on GABA A. Then the receptor of benzodiazepine produce a chlorine channel complex, which increase in frequency of opening chlorine channel, and besidely it also increase the mediated chloride conductance. So what happened? The membrane get the hyperpolarized and CNS get depressed. So what are the adverse effect of benzodiazepine? The adverse effect list are started with drowsiness. Next, confusion, blurred vision, amnesia, disorientation, tolerance, etc. Benzodiazepine may have no effect on gamma mimetic action. It generally may used in case of different types of surgery, which is related with sedation and hypnosis, um, anticonvulsant, pre-anesthetic agent, which I told that surgery cases, anti-anxiety, muscle relaxant, to treat alcohol withdrawal symptom in sometimes which is rare in case, consciousness for sedation. Now, what is barbiturate? Actually, what does it do with the patient? All barbiturate are derivatives of barbituric acid. They are non-selective CNS depressant and act at any site ascending reticular activating system being the main site. Average dose of barbiturate are between 50 to 100 milligrams, which are available in pill, liquid, rectal, and injectable forms. Their effect lasts long, between 4 to 16 hours. The mechanism of action barbiturate is, firstly, it binds to GABA A receptor, which is produce a complex benzodiazepine binding site, which is produce a chlorine channel complex. Then the duration of chlorine channel kept open, which is increased. The increased GABA mediated chloride conductance occurs and membrane get hyperpolarized. So CNS get depressed. What are the adverse effects? There are common side effects are drowsiness, confusion, headache, ataxia, hypotension, respiratory depression. Sometimes the hypersensitivity reaction like skin rashes, itching, swelling of face may occur. The therapeutic use or pharmacological use, we can say this barbiturate can use in sedation and hypnosis. They have a low therapeutic index. They cause rebound increase, rapid eye movement sleep on stoppage of therapy. They can the cause of marked respiratory depression. Sometimes this barbiturate can use in general anesthesia, anticonvulsant, neonatal jaundice of non-hemolytic type, and sometimes diagnostic aid in psychiatric patient. Now you can see here are some enlisted benzodiazepine drugs with their formulation, dosage, and important points regarding the drugs. Like diazepam, it generally used oral form, and it may also get in intravenous, intramuscular, and rectal form also, and the dose should be 5 to 10 milligram. It is rapidly absorbed by the GI tract, produce active metabolites, no residual effects on occasional use due to redirection restriction. It is used to control convulsion but not for long-term therapy of epilepsy because its sedative effect and rapid development of tolerance to anticonvulsant effect. tolerance is a effect where drug is tolerable. The longer use of a same drug can be resist by the patient. Now, after that, the dose need to increase day by day. It can be used um, rectally to control convulsion. Next is flurazepam. As you can see, it is formulated by oral only, and 15 milligram is the dose. It is useful in case of insomnia, causes of hangover effects. Then nitrazepam or nitrazepam. It is orally formulated drug which is available in 5 to 10 milligram doses form. As we can see, lorazepam, alprazolam, temazepam, triazolam, midazolam, and chlordiazepoxide. All drugs are enlisted by this table, and you have to just read carefully with their dose and formulation, besides with their important point, what are the role of the specific drugs, what are the advantage of the specific drugs. Okay,